One of the books that we will be discussing on this channel is Remaking a Life: How Women Living with HIV and AIDS Confront Inequality. This is a book that was written by Celeste Watkins-Hayes, and it is a book that is based off HIV and AIDS here in the United States. She particularly was interviewing women living with HIV, Black women living with HIV, African American women living with HIV in Chicago in the United States. And I'm going to read a page from Remaking a Life. This is page 25. Page 25 talks about what this channel is all about: social determinants of health, what they are and how they are making our communities unhealthy. And social determinants of health, as I've tried to explain before, these are the factors such as race, gender, age, social, economic status, geographical location, right, that can influence and perpetuate the spread of disease in our communities. So I am going to be reading from page 25. I'm short-sighted, so I don't need the glasses when I read. So I start here. Black women have been disproportionately affected by the HIV and AIDS epidemic. In January 1983, when the Centers for Disease Control and Prevention, CDC, documented the first 2 cases of AIDS in women, one woman was Black and the other was Latinx. When I began this research in 2005, Black women comprised 37% of Chicago's female population, but they accounted for 80% of female HIV diagnoses, and HIV and AIDS was the #1 cause of death for Black women aged 25 to 34. More than a decade later, racial disparities persist. Among all US women with HIV diagnosis in 2015, 61%, or 4,524, were African American. 19%, 1,431, were white, and 15%, 1,131, were Latinx. That year, HIV and AIDS was the 4th leading cause of death among Black women ages 35 to 44, before diabetes, stroke, and homicide. Younger generations of Black women continue to be affected, as HIV and AIDS remains one of the leading causes of death among those in their 20s and early 30s, while women from other racial backgrounds have fortunately seen the illness drop below that top 10 leading causes of death. Black women have also been unsung leaders and foot soldiers in HIV and AIDS activist and advocacy work. For these reasons, their experiences constitute a central part of this analysis. For these reasons, their experience constitutes a central part of this analysis. Remaking a Life takes readers deep into the lives of 4 Black women to trace the what, why, and how of transformative projects using data collected through more than 10 years of engagement from 2005 into 2015. Dawn's story is presented in this chapter, and in subsequent chapters, I present the stories of Keisha, Beverly, and Yvette. Many women living with HIV and AIDS have experienced multiple injuries of inequality. For them, the diagnosis was unceremoniously added to a long list of urgent concerns. For other women, the HIV diagnosis is a stunning setback, an experience that contradicts the relatively smooth trajectory they believed they were following. They come from a range of racial and ethnic backgrounds. Many do not have histories of drug use or sex work. Some are quite well off economically with high levels of education and white-collar jobs. Others contend with the added dimension of immigration status as they seek assistance to address health concerns. Hearing from a diverse group of women enables us to consider what it means to confront HIV and other difficult life events from multiple vantage points. So you can see from just this one page that the author has mentioned multiple factors, right, that are making this disease unduly affect Black women specifically, right? Um, and there's also another page that I want to read a little bit of so that you can understand the layers and layers of multifaceted factors that affect these communities and make the disease to easily spread. This is in her conclusion on page 229, where she titled this chapter, Inequality Flows Through the Veins, Transformative Lessons from the AIDS Response. In communities around the world, there are women whose lives are remarkably similar to those of the women we have met in this book. They are stigmatized because of some undesirable social characteristic, deemed unworthy and undeserving of our care and concern. Their lives may have been relatively stable before the crisis arrived, or they may have suffered from a host of physical, emotional, and economic traumas. While some may be tempted to disregard these women or ignore their potential, it would be foolhardily to do so. We lose valuable political voices, mothers to children, partners to those looking for loving relationships, and teachers to those of us trying to understand important issues. We lose valuable members of our nation and even the world when we choose to ignore, stereotype, or reduce women to the circumstances they face or the choices they make, especially when these choices are so limited. Many of the personal transformative projects I have described benefit the greater good, and their distributions would be lost without the courage of the women who carried them out. So this is one of the books that we will absolutely be discussing, and I absolutely look forward to having a conversation with the author. I will be tracing her down. I will be looking out for Celeste, and I hope she'll say yes one day. But if you want to get ready for some of the conversations we're going to have, please do make sure that you buy this book. It will give you a good outlay of the influence of social determinants of health when we talk about the spread of HIV in our communities. Lovely day and a healthier day. Bye.